Hello everyone, I am Dr. Om Prakash Namadar, Consultant Pediatrics and Neonatology at Apollo Hospital, Navi Mumbai. Today we are going to talk about recurrent infections in children. In fact, in monsoon season, many parents are complaining presently that my child is getting ill again and again. क्यों बार बार बच्चों को ये इन्फेक्शंस हो रहे हैं? क्या मेरे बच्चों को कुछ इम्यूनिटी का डेफिशिएंसी है या उसका न्यूट्रिशन अच्छा नहीं है, इसके कारण ये इन्फेक्शन हो रहे हैं क्या? ऐसे बहुत सारे प्रश्न हमारे मन में आ रहे हैं. So let's try to understand why they are getting recurrent infection. So if you try to analyze, after the birth of the baby, the initial 1 year of life, they get protection from the mother's antibody. जो माँ की प्रतिकार शक्ति है बेबी को इन यूट्रो मिल जाती है, and that helps a lot to prevent infection. But as the time progresses, particularly from 9 months onwards, ये प्रोटेक्शन बेबी का कम होता है, and then this is a time where their own immunity system develops, and that is the reason if you see जो इनिशियल वैक्सीनेशन जो रहता है हमारा इनिशियल 2 years में मैक्सिमम वैक्सीनेशन है, बट इन दैट ऑल्सो द फर्स्ट ईयर इज़ वेरी वाइटल टू गेट all the necessary vaccinations. And I must say here that this month of August is celebrated as National Vaccination Awareness Month, and with that connect also I am going to talk about this recurrent infections in children. Okay, so 3 to 5 years का जो time है, in that there is also exposure of the children to the surrounding. Initial 1 year में there is not so much exposure because they are in the home surrounding with not much exposure of triggering factors. But as they progresses in their developmental milestones, their contact with the community increases, their contact with other kids increases. तो ये जो हम recurrent infection जो है 2 years to 5 years के बच्चों में ज़्यादा दिखते हैं, क्योंकि उनका एक्सपोजर जो है पर्टिकुलरली डे केयर में जाते हैं, स्कूल में जाते हैं, और वहाँ पे किसी भी बच्चों को सर्दी खांसी है, लूज मोशंस है, वोमिटिंग है, and these all viruses spread very fast from one to other, and that is how they get this recurrent infection. And अगर infections में अगर सोचेंगे तो commonly we see fever, cough, cold, loose motions and vomiting. So let's try to understand what we can do to help these children whenever they get these symptoms. So fever is not a disease, but it is an effect of the disease. Whether it is a viral infection, whether it is a bacterial infection, this is manifesting as a fever because fever is a response of the body to fight with infection. So we should not be too much worried about the fever, but we should try to find out fever का रीज़न क्या है, whether यूरिन का इन्फेक्शन है, रेस्पिरेटरी मतलब ब्रीदिंग के रिलेटेड इन्फेक्शन है जैसे कि कफ कोल्ड है, या और दूसरे कुछ इन्फेक्शन के कारण बच्चे को फीवर आया है. बट सम किड्स दे गेट वेरी टायर्ड एंड lethargic with fever. So that's the reason we give fever medicines to make sure the child is comfortable. If fever is decreasing over a period of time, fever का intensity कम हो रहा है, plus in between fever अगर बच्चा active है, that tells that the fever is more likely because of some viral infection. तो ऐसे situation में just paracetamol is enough to control the fever. लेकिन अगर fever response नहीं कर रहा है, fever के कारण baby very tired, lethargic हो रहा है, या बेबी का एक्टिविटी अच्छा नहीं है, ऐसे सिचुएशन में वी जस्ट नीड टू गेट इन टच विथ योर डॉक्टर. सेकंड सिम्टम इज कफ एंड कोल्ड. अगेन कफ कोल्ड is one of the commonest causes viruses, but there are some episodes where there may be associated throat infections or there may be associated lung infection that contributes for this cough, and then accordingly we need to get in touch with the doctor and take the medications. Loose motions, vomiting, again I will say commonest cause is because of the viruses, and the commonest problem with loose motions, I always tell to the parents, don't count the number of motion the child is having, but count how many times the child is drinking liquids, eating food, and how many times the child is passing urine. It is the dehydration which is more worrisome for us in case of loose motions and vomiting. So that's the reason the oral dehydration solution ORS is very important. Along with that, zinc supplementation is equally important to help them to recover faster. And your doctor will advise some additional medicines, probiotics, as well as some dietary changes to improve the child's motions and vomiting faster. So these are the common causes, common recurrent infection that we see. Now let's talk a bit about prevention of these common recurrent infections. Hand hygiene is one important factor that is going to be very helpful for us. Second is having a clean source of water. If you are in doubt, make the hot water sterilize using filters as well as making it hot, and then using a warm water also helps them a lot. Then the next is preventing exposure to someone who is having active fever, cough, cold. As much practically possible you can do that, but I am sure in the daycare or in the school, somewhere or other the child is going to have some contact, and then they are going to catch these viral infections. So we need to be practically possible, I say as much possible, but it is not 100% possible for us to do that. Next is diet is very important. As much as possible, homemade freshly prepared food is also going to be very vital. And additionally, I must say here that use of fruits and vegetables also helps us to give us the micronutrients. Vitamin C, all of us are familiar, that is going to be very helpful for us to improve our boost up our immunity. The next part is vaccination. Due to COVID, many of us have tried to understood how important the vaccination is there. I am sure all of you have got the necessary vaccination. Kids less than 2 years particularly, we need to make sure they are receiving all the vaccinations as far as the national immunization schedule is concerned. In addition to that, I must say here, only in India we have got a concept of compulsory vaccines and optionally vaccines, because the government is trying to add all the vaccines as much as possible, but they may not be able to give certain vaccines due to certain limitations. So those who are able to take all the vaccines, whether they are optional or compulsory, is always better than just opting for the compulsory vaccines. So how the vaccination helps us? So vaccination helps us not only to prevent the primary infection, but also to prevent the complication associated with the infection. It's like you may get an infection, like हमने जैसे कोविड में भी देखा है, जिन्होंने कोविड का वैक्सीन लिया है उनको भी कोविड का इन्फेक्शन हुआ, लेकिन उसका सीवियरिटी बहुत कम था. इसी तरह से वैक्सीनेशन का बहुत इम्पोर्टेंट रोल है. और जैसे मैंने बताया कि दिस मंथ इज़ अ vaccination awareness month, so I will stress a bit more on the vaccination. In that particularly, there are certain vaccines which are very, very important. One is the pneumococcal vaccine, because we have seen so much of drastic reduction in the rates of pneumonias that we used to see earlier. The seasonal flu vaccine also plays a vital role to prevent this certain recurrent seasonal infection because of this flu virus, or a swine flu, what we say in common language. So this is very important, and the strain of this virus changes annually. That's the reason WHO suggests this vaccine to be given annually to the children, particularly children less than 8 years, less than 10 years. It is good to take this vaccine every year. So this will help us to prevent the recurrent infection that the child is going to get. However, if there are certain danger signs, I will be careful about. In case of acute infection, in case of any infection for that sake, if the fever is very high grade, which is making child sleepy and lethargic, there are some seizures or fits, hydration is not maintained because of the poor intake of the food, child's urine output is very less, or along with the fever there is a rash all over the body. In that situations, you need to get in touch with your health services immediately. Next thing is we should look at the other danger signs, whether there is an underlying immunity deficiency, less poor immunity, what we'll say, in children, that is contributing for these recurrent infections. If your child is getting recurrent infection where there is a need of repeated doses of antibiotics, if there is a need of hospitalization requiring higher antibiotics, if the child's weight gain is not happening well, these are the signs that we need to look whether there is any other reason why the child is getting repeated infections. So these are some red flags that whenever you come to the clinics, to the hospital, we assess, and then accordingly we decide whether it is just a routine repeated viral infection or whether it is a severe infection which is related to the pure immunity, the poor fighting capacity of the child, and we decide accordingly. So I hope you should not get too much worried about the recurrent infections, provided the child is happy, provided the child is taking oral feeds, as well as the child is playful in general. So let's take care of this bad weather situations where we are getting a lot of infection, and at the same time we should take necessary precautions, and not to forget about the vaccinations. We should make sure that every child is vaccinated with all the necessary vaccines as suggested by Government of India as well as the Indian Association of Pediatricians. Thank you very much.